How you doing, everyone? Today we're going to be doing a little bit of therapy in the lower limbs. So we'll do this in our office for cases of maybe a plantar fasciitis, Achilles tendonitis, or any other lower limb injury, ankle sprains. We can apply some of these therapies. This is going to be what's called an active release therapy. Our goal right here is to kind of clear away and strip away some of the adhesions and scar tissue in the muscle or ligamentous tissue. Now, how we're going to do it, our first step we're going to go through is going to be to loosen up the gastroc muscle. This is kind of the gastroc muscle. We have our lateral belly and our medial belly. We're going to do a quick pass on how to address the lateral belly. Medial belly done the same way, except our contact point is going to be more on the inside. So how we're going to do this, we're going to be starting with our patient contracting that muscle itself. So we contract the gastroc by pointing our toes down. This is our start position. And as we proceed through the treatment, we're going to have our patient bring that foot into dorsiflexion, just kind of stretching out that muscle. So my contact point is going to be with my thumb. I don't want to use a thumb point that's really going to hurt my thumb over time. So I'm going to do a nice loose contact across the middle of my thumb. And I'm going to use my other hand to give it some support. And I'm going to have the patient, again, point the toes down for me. And now start bringing that foot up into dorsiflexion. And as they do that, I'm just going to assist with my knee. Good. Now, what my thumb is doing it's a light little tissue pull upwards as we start moving that foot into dorsiflexion. And we're going to work our way down about 4 to 6 passes, making my contact, lateral gastroc, and we're going to bring that foot up into dorsiflexion as I'm putting a little bit of light tissue pull. Good. And we'll do that again. So again, this is a little active release for the gastroc, specifically the lateral gastroc. Now, if we worked on the medial side, we simply just change positions of hands and we'd work it the same way. Coming here, contact point, and we bring that foot into plantar flexion and then gently through dorsiflexion. Again, my tissue pull is going up with the tissue. Starting here, running up with the tissue. Hey guys, we're going to be moving over to the soleus muscle, and if you're aware, the soleus muscle sits underneath the gastroc. And what we're doing right now is we're bending the knee to take the gastroc out of the equation. This is going to relax the gastroc and give us a little better access to the soleus. Typically working on the soleus, I'm going to work a little bit under the belly of the gastroc, and we're going to perform the same procedures we just did a little bit earlier for the gastroc. We have our patient initially start with that foot in a plantar flexion, and then we're going to make our contact right at the soleus, kind of moving that gastroc out of the way, making our contact with our thumb in a loose fashion. We're going to add a little pressure here, and we're going to have our patient slowly dorsiflex and come up. We're going to move it down a little bit, bring that foot fully into plantar flexion, and then slowly dorsiflex as we use our foot to assist up. And just a refresher, our tissue pull is coming up with the tissue as we go through the motion. All right. How you doing, guys? We're switching gears right now to the more lateral aspect of the lower limbs. We're going to see this very useful in cases where we have ankle sprains and, again, Achilles tendonitis or lower limb issues. We're specifically going to be working on the peroneals or the fibularis muscle, the longus and the brevis. The major function of these muscles is to bring that foot down and out. So we'll start the patient with that foot down and out. And the motion you're going to go through while we're performing our active release therapy is the foot's going to come up and in. Now, our contact is going to be pretty straightforward for the peroneus longus. We're going to be finding that fibula, and we're going to be doing a little bit lateral to it. And we're not getting a real pinchy grip on it. Again, this is going to hurt our thumb. We're going to get a nice loose grip. We're going to make our contact, and we're going to start with the patient foot down and out, and let's bring it up and in. And my contact again is going upwards and bring it down and out again. Now, I could switch hands just as well. I can make my contact here, down and out, and let's bring it up and in. Good. And again, contact point, down, bring it up and in. Good. Down and out, up and in. Good. Now, to work on the peroneus brevis, we're going to start a little lower. It's going to be the same motion of the foot, down and out to up and in. I'm going to make my loose contact. Again, I'm going to find my fibula, which is going to be right here. Lateral malleolus, I'm going to go slightly above it, right through here. Make my contact loose with my thumb. And my tissue pull as I do this is going to be slightly up towards the knee. So down and out, bring it up and in, good. Down and out, and let's bring it up and in, making my contact. And again, this shouldn't be too pinchy, that's not too pinchy. Down and out, and let's bring it up and in. Good. And again, 4 to 6 passes on all of these, down and out, and up and in. Now, we can also assist this by using our body or our knee to help push that foot through its motions. But oftentimes it's enough if we're just using our hand contact and having the patient do most of the work in an active fashion rather than me assisting in a passive way.